progress in the field of melanoma are the development of TKI, the tyrosine kinase inhibitors, for the melanoma that are BRAF mutated. It's roughly 40% of the patients. And these BRAF MEK inhibition are very effective and the most powerful, at least for the short term. The second progress is concern all the melanomas, and it is the PD-1 blockers. The PD-1 blockers which are more slowly active than the TKI, but with long durability of the benefit. And now we see roughly 20% of patients for whom we can stop the treatment because of complete response, and when they stop the treatment, they don't recur. So we can maybe speak of cure of distant melanoma, which was an impossible dream 2 or 3 years ago. For the patient with a little amount of distant metastasis that can be operated, it is an opportunity to offer to the patient. And after those patients have been operated, we can offer them an adjuvant therapy, mainly with nivolumab. Also, a lot of new ideas that comes with TVEC, with a toll-like receptor agonist. The progress is still arriving. So this is the point now is PD-1 blocker, but I think in 1 or 2 years, a lot of drugs will be added to the backbone of PD-1 blockers. All these drugs are toxic, and the PD-1 blockers induce in roughly 15% of the patients adverse events, which are immune-mediated and which can be life-threatening, such as myocarditis, Guillain-Barré syndrome, and so on. But it is well tolerated in the vast majority of the patients. But the dermatologist should be aware that a few percentage of patients will suffer from the drug, and that there is specific action to once the diagnosis has been made, to improve the outcome for those adverse events. I think that dermatologists should know that once the melanoma has metastasized to the distant organs, there are numerous of possibilities now that are very effective. The effectiveness is increasing fantastically with PD-1 blockers, with BRAF MEK inhibitions, and there are also a lot of progress that comes. And the overall survival of melanoma patients with distant met must be now more than 3 years in median overall survival. So there is progress, and dermatologists should know that they should address the patient to teams where such progress can be applied.